Franklin County. Thank you, Matt.
The only thing I'd update on is we're seeing pretty healthy enrollment. We just finished a summer class and all of our fall classes are full. I'm not sure why, but that's encouraging. So we continue to work on it.
All right, thanks, Scott. Warren County has told us they had no report, they couldn't stay. And Washington County,
As far as Washington County goes, we're still working on the, guess we'll just use the future of EMS business. Thanks to Mark, who's kind of spearheading things. Self-appointed, I guess, but nobody else really wanted to do this. But anyway, he's going to address some of this later, but I'm just saying, I think things are better. I mean, it's been very busy. I mean, the squads are busy and they seem to be handling the calls as best they can. And then all about the patient, as I've said before, for 50 years. So that's it for me.
okay, thank you, Bruce. New York State DOH.
We're out doing inspections, trying to get caught up from when we were grounded for COVID. Joe Farrell is retiring as of this week. He's still on state payroll until October, but this is his last week officially working. Wish him well after his 20 some odd years here. When renewing agencies, please be sure to use the portal. Okay, it's on the same page where you get the forms, and it will tell you, depending on what you're doing, which form to use. So the portal is your friend. And if you're looking for agency operations, the portal is the last line on the forms page for that section. The same is true with controlled substances. We're asking that you not go to your filing cabinet of forms anymore and pull out forms from when Joe started. Because a lot of the forms have been updated, they're fill-inable, and they prefer them typed in now that they've made almost everything PDF fill-inable forms. The other thing to consider, and it hit the folks down here in the Glens Falls area, is you might want to consider having a backup medical director. So I'll use the Glens Falls group. Oh, you guys were in a pickle when Tom Williams was unavailable to work for a little while, getting some stuff signed in a timely fashion. Had you listed one of the other Glens Falls docs, they could have signed it in his absence, as opposed to waiting. This is at the suggestion of B&E. And what you have to do is when you submit your B&E paperwork with your renewal, submit a second page that says, you know, Tiff Bombard is our backup medical director. Her DEA number, her New York State number is all the information you would have in case our primary isn't available, and then they both sign it. I'm not throwing Tiff under the bus for every agency. She's just sitting there staring blankly. Hi, Tiff. But
You guys can do that. Like, if you want to use me as your backup medical director, that's sort of an open offer. Just please let me know if you did that. That's all
Yeah,
I ask.
well, that's why they need to get the form signed by you also, so there is no surprise. You know, the addendum that you can just have signed by the two docs.
certain form
I'm happy to do that.
No, just,
In case
do
your
a separate-
medical doctor goes into cardiac arrest while running down the road, which is what
Right.
happened to Tom Williams.
so just do a separate sheet of paper included with your renewal. But you need to have the medical director sign that they acknowledge this. Yeah, and running a triathlon.
Holy shit.
So do you guys want to hear that? Here's a little entertainment for you, which is an open secret, not a secret. So Tom Williams is in Rochester, New York, running in a marathon. And there's like 2 laps in the running part. I don't even know, it might have been a triathlon, but anyway, there's 2 laps in the running portion of this. Each time, so there's 2 times in this entire race, he's going to run by his wife. As he goes running the lap by his wife on the second time, he drops, goes into cardiac arrest. She pops out of the crowd and does CPR, and EMS intervenes and they get Rosk. And he goes to one of the Rochester hospitals, whichever giant hospital it is. Where was it?
Wrong, I believe.
Wrong.
So
We are
He-
looked at him.
he has an LAD dissection. That's his reason for cardiac arrest, which there's no way if you were at a regional hospital they could fix, but he happens to be in Rochester at a big techno medical center and they fix him and he's at the REMAC meeting today. But talk about, holy cow, the story. And if somebody has more to add to that story, please put in the window dressing. But I thought that would be well worth one moment of your attention because it sure got mine. It just makes me want to hug him. I'm so excited he's still on this side of the dirt, right? So cool.
Absolutely.
That's it. Anyone have any questions for me? Otherwise, that's it.
Alrighty, thank you, Mary.
Yep.
Old business.
So the whistleblower policy, we've talked about it a few times now, we need to actually approve it, so then we can send it out to everybody and have everybody sign it. I don't know if it was sent out after the last meeting or not. But then also the conflict of interest forms, those did get sent out, that just, we need those every year. So I'll follow up with people that I haven't heard back from. We probably, have you guys seen the whistleblower policy or no? Very good, familiar enough to vote on it, sounds like a no. We'll hold off and I'll make sure it gets sent out, so that'll be our next agenda again.
Okay. Alrighty, new business. Mark.
Hi.
Gonna have you talk to us about the rural ambulance task force update.
Thank you. So for those of you, that don't know, of course, my colleagues from Washington County have probably heard some of this stuff right now. I was appointed to the governor's rural ambulance services task force, in the spring. And, the idea is to, get some folks together to create a legislative agenda and recommendations to send to the state legislature for revamping, revitalizing, sustaining rural EMS in the state. So there's 16 of us from around the state, representing a whole host of different type services, commercial service, fire-based service. Some folks that aren't in, there's commercial, there's, volunteer, there's a variety. Ann Smith is actually the chair of the group, and she maintained that, even though she transferred out of Fort Drum and is with the Department of Health now. She maintains the chair of that particular group. So we've met in a variety of ways. We do meet once a month in person. We're meeting in Oriskany at the State Emergency Preparedness Center. And then we established, or the group established, at our first meeting, 4 standing committees to break down basically the bullet list of things that we had kind of addressed in our brainstorming session. And the committees are staffing, systems, standards, and finance. Each member of the task force is on 2 of the committees. And the committees, for the most part, are meeting bi-weekly, and we're meeting, obviously, virtually to put our pieces and parts together. We do meet in a couple more weeks out in Oriskany. So I just thought I'd kind of give you an idea. We were actually asked, at the last meeting, it was recommended that we all reach out to our REMSCOs and just kind of update them on where things are. One of the things that we have found is that there does appear to be some bit of disconnect with the REMSCOs, even between REMSCOs, REMSCOs and program agencies. And just not a lot of alignment. I think, historically, this REMSCO and program agency have been very closely linked, whether it's been within the same umbrella, in the same office, or in different offices like it is now. So a little bit less as compared to a lot of the other places in the state, for sure. So let's see, my 2 committees are staffing and systems, which have been going really well. So one of the things that we've been told is, number one, think outside the box. I will say that Ryan has been great in the fact that he's been guiding what we're supposed to do, but at the same time saying, listen, what we're doing may not be working. It may not be the most efficient. So we need to kind of blow this thing apart and see where we come up with. So from a data perspective, we've collected a ton of data. Some of it, I'm sure that the REMSCOs could have access to, generally to the, general EMS agency, general EMS organization. Some of it is not available. A lot of it has come from EPCRs, but some of the things that I can kind of share in summary, you know, the number of actually certified EMTs in the last 3 years is down by about 25% statewide. The number of paramedics that have appeared, certified paramedics that actually appear on a PCR within the last year is just slightly over, I think it's like just over 50 or over 55%. So there's a lot of people, a lot of certified people that aren't practicing and not a lot of people going into it. Now, Scott, I know you mentioned that, you know, your classes are full in Franklin but Storm, I heard you in the REMAC meeting saying that your courses are at risk of being canceled. That's not uncommon. You know, we've certainly seen the attrition in Mountain Lakes now for a number of years. It's not uncommon. It's one of the big concerns. We can't get people into the classes and that those that are going into the classes, the attrition rate is over 25%, and in some places it's worse than that. The other thing that's a noticeable thing that we actually asked for, the number of people that actually make it through the class but never test. They never take the state exam. And so actually we're looking to see if there's a possible link to the fact of doing the online testing the way it is now, to the fact that people aren't going to do that certification test afterwards, as opposed to, you know, taking the test where you were. So just a lot of really interesting data. Certainly we pulled data and reports from several other states. So just a lot of stuff coming in.
Was there, were the paramedics documenting on the PCR is just over 55%? You know if that's up from the past?
I believe it's down. And the total numbers are certainly down. There is a survey that will be coming to the REMSCOs and program agencies here very soon. We just finished up the actual questionnaire. Each committee had to submit up to 5 questions for the survey. So that'll be coming, and certainly we were actually sending that particular survey to the major stakeholders, the REMSCOs, program agencies, some of the state associations like UNGAN, NYSPERA, FASNY, to try and get a collective input with that. There was a survey that went out to the EMS coordinators in the state, and that data was reviewed at our last meeting. It looked at countywide systems, response times, mutual aid agreements, those types of things. So for those, I know that Bruce participated. I don't know, and looking, I don't remember specifically what other Mountain Lakes counties did or didn't participate. But that data is still out there. If you didn't get it or you didn't think, you know, shoot me a note. I can have, we've got 3 interns working for it or working out in the task force for the summer. So they certainly can get that information to you. So really good information in that. Some of the themes, certainly systems approach is the biggest thing, that we've got to enhance the system. You know, trying to fix individual agencies just isn't going to work. And I think there's a realization with everybody there that unfortunately there's some agency levels that just aren't going to survive this, whether it's now, whether it's in the future, whether it's been in the past. We know what the number of ambulance closures are. Recognize that, you know, volunteerism is significantly down. In fact, and this is what's kind of, to me, is actually concerning, is in these meetings, our group meetings, there's actually not a lot of discussion about volunteerism and about recruiting and retention, because there's a lot of feeling from others, again, people from around the state, that it's spending a lot of time, a lot of energy, and potentially a lot of money on kind of a lost leader. That revitalizing that EMS volunteer base is probably just not a good direction to spend a lot of time and energy and effort. Not that it's not still considered, because it really is, but not considered as the primary source of manpower, personnel power moving forward. One of the other big themes is
Nothing, I just want to give you a heads up warning to maybe like 3 minutes.
Okay, yeah, sure. Who's responsible? Certainly, that's a big question. Somebody's got to take the role of legislatively being responsible for providing EMS in an area. It's looking like the recommendation is going to be saddling the counties with that responsibility, based on a set of standards. Lot of discussion about what we commonly refer to as mutual aid. If we know that there's coverage gaps, those gaps need to be filled. And not just with the next closest agency. If you know a community doesn't have a resource, then there's got to be something available to send a resource to that community. A lot of discussion about PSAPs taking a more important role, instead of letting them be decision makers, so that they can do that. Certainly funding is a major issue. A lot of discussion about things like taking the concepts of ET3 and making them applicable in the state, where you actually, payers, with the exception of Medicare, obviously, that we can't control, or the state can't control, but requiring payers, including Medicaid, to pay for no transport options. A lot of talk about the right response to the right patient at the right time, that just getting an ambulance there as quickly as possible is not the right thing. Getting the right type of crew to that patient in a reasonable amount of time, is there. Lots of discussion about requiring leadership and professionalism, leadership training, professionalism type of thing. What are the next steps? After the survey is done, we're taking that data. There's going to be a number of town hall meetings that will include, there'll be EMS providers and agencies will be invited to. They will be virtual. There'll probably be 5 or 6 of them in the state. And then the survey results from the REMSCOs and the stakeholders will be used for that. We're going to engage those stakeholders. One of the big reasons is, one of the reasons that Part S failed or most of Part S failed in the governor's budget is we actually did a post-mortem on it. And we didn't have as EMS providers, excuse the expression, we didn't have our shit together. People opposed different reasons. There were actually REMSCOs that just wrote a letter that said, we just don't like this section, so we're going to oppose the whole thing. And a lot of throwing the baby out with the bathwater. So our idea is if we get the stakeholders together and present a unified front, we can get our stuff together. The legislature is going to hopefully be on board with it. Finally, 2 quick outcomes. We talked about the funding. Standards look like they're going to be a real thing. But the standards are going to be carrot-based and not stick-based. In other words, that there's going to be some different, the idea is some different levels of standards. If you meet those standards, you meet different levels, you will get certain rewards for it. Like perhaps instead of being inspected every couple of years, maybe it's every 5 years that you get an agency inspection. Maybe you'll be eligible for different grant funding that might not be available if somebody doesn't meet certain standards. So those standards are kind of out there. The SEMSCO is also looking at the exact same type of thing. So I would definitely bet that, some sort of agency level standards will be coming. I have questions, but one other just quick note, completely off topic. For those of you that didn't see it, and it's coming out now, there will be a CIU for anybody that needs instructor update at Hudson Valley on Thursday, the 28th of September. I think it's getting pushed out now. The seating is going to be somewhat limited. It is the 3-hour state requirement. It's through Remo, and I think if you go to the Remo site, you'll be able to register for that.
People were asking if it was gonna be virtual.
No, I actually talked to Tony Caligari today. He called me, and no, they're going to repeat it again in January. The same type of thing.
Any questions for Mark, anybody?
Thank you.
Thank you, Mark, for the. We are, actually, there's the public comments. Anybody got anything they wish to comment? That's interesting.
So there is one thing that I forgot to mention that I did talk to the REMAC about. So as a program agency, we are tasked with different deliverables outside of what the REMACs and REMSCOs are. And one of them is being involved in QA, QI, and education. So we are going to start an initiative out of our office for our super region, so the North Country and Mountain Lake side, where we're going to do random chart pulls from agencies. Just review them. There's nothing punitive against it, nothing like that. It's just to review it and see where we're having shortfalls in education maybe, and be able to develop more education for better documentation. Because we just recently did a stroke screen and we're working our way through the super region right now, and we're finding some scary things when it comes to documentation, where if we can come together with a more unified, uniform way of this is probably how you should be documenting it, because what you're doing really isn't working. We can work with the agencies, we can work with their medical directors and develop better providers. So that will probably start in the October timeframe with the new quarter. Cause I have 2 paramedics on staff that get bored, so I'm gonna find them more work.
Okay. Thank you, Jonathan. Anybody, else, anything? Motion to adjourn? The whole row. Second from that row as well?
Go for it. I mean, we did it the first time around.
Okay, next meeting, October 23rd. See you then.
Thank you.
Thank you.